how long is this going to take for me to do my treatment and how's it going to impact on my life? So when patients come into the clinic and they are looking at treatment, the question I always get is, how long is this going to take for me to do my treatment and how's it going to impact on my life? And I think it's different for every single patient that comes in. Some people have day jobs, which involves them going into their office every day. Some people work from home. And so I try and draw it out pictorially for them so that they understand the sort of timeline, but we all know it's different for each patient, right?
So what does a typical treatment cycle look like?
So for most patients nowadays, clinics tend to use something called a short protocol, which essentially is jargon for starting the stimulation drugs as your period begins. So if we take a fictional day, the first day of the month, and then say to the patient, you're going to do a short protocol, in general, by about day 12 of the cycle, day 13 of the cycle, they'll be triggering ovulation for a timed egg collection in theatre. And this is where the lab's really important. And so it's really important for me that the patients understand the journey through the clinical phase with the injections, the scans and the blood tests that they may have over that stimulation period, but also so important to involve the lab so that they understand what happens after an egg collection.
So it's probably really key to tell our patients that when they ask you a question of how long a stimulation protocol is going to take, they're probably asking you about their work-life balance. Because actually, once the eggs are out of the body, they don't really need to be in the clinic at all for the next 5 to 6 days, and that's only if they're having a fresh transfer. So maybe we could talk about the difference between fresh and frozen transfers and what the commitment is there for the patients.
Yeah, I mean, so I think the Evewell will tend to do a lot of frozen transfers because a lot of patients will be potentially screening embryos and looking at their embryos, screening embryos genetically to look at the chromosomes. We call that PGTA. But not all patients. So some people, as you say rightly, after their egg collection, which let's say is 2 weeks after they've started their drugs at the beginning of the month, the medication is finished, they've had an egg collection, your team will be in touch with them over those 5 days post-egg collection, and they'll be coming back into the clinic for one of our team, my team, the doctors, to put that embryo back in to the uterus with your assistant.
Yeah, so I think it's also really important to note that if you are having a fresh transfer, we do want the embryos to be at the blastocyst stage on day 5 to be able to give you the most optimum outcome for that transfer procedure to work. If the embryos are being frozen, we will contact you on day 5, day 6, day 7, whenever those embryos reach the blastocyst stage, and discuss your options around testing and freezing, quality of embryos, and the elusive grade.
And if you're not having a transfer, patients often ask me how long till I'm going to get my results back. And I think if we take that fictional day as you start your period at the beginning of the month, and then you think about your timing of your egg collection, the time that your team will be looking after those embryos in the laboratory, followed by embryo biopsy, it's probably roughly another week after biopsy before your team will be calling them and saying to them, these are the results that we have for you. But some people won't have an embryo transfer immediately and actually will be biopsying those embryos. And the question I often get in clinic is, so how long till I'll know the results from my PGTA? And roughly speaking, you're biopsying those embryos between days 5 to 7 of development, and they can expect a result a couple of weeks later.
2 weeks after we've sent the cells to the genetics lab, we will be in touch once the results pop into our email. The aim is to have those results to the patient before they sit back in front of you in the clinic.